Well, in my years in headache practice, the biggest change I've seen in ideas about when to use preventive therapy has to do with the timing of starting therapy. When I first began, I think it was common for doctors and patients to delay starting preventive treatment for migraine. Patients often don't like to take something every day, and I think doctors had a fairly pessimistic view of what preventive migraine therapy could do because some of the older drugs were not necessarily all that effective, and some of them had unpleasant side effects. Certainly we don't have perfect drugs today, but I think the drugs we have are better. They tend to be quite well tolerated. And in addition, there's a lot of evidence now that delaying treatment of migraine may be a bad thing. We have mounting evidence, for example, that untreated and frequent headache attacks can lead to structural changes in the brain, and that, along with the improvements in preventive therapy, I think has led a lot of people to re-examine when you should start preventive therapy. Most experts now would say sooner is better. Certainly if patients are having very frequent attacks or are disabled by attacks or aren't getting good results from abortive therapy alone, I think the preference now and the recommendations now are to start treating with preventive therapy. The hope, which remains unproven at this point, but the hope, of course, is that such early in a timely fashion might prevent some of the bad downstream consequences, that you might see patients having fewer attacks over the years, less disability from their headaches, and although it's completely speculation at this point, perhaps it will ultimately have an impact on some of those structural changes that have been demonstrated to occur with very frequent attacks. That's what everybody's hoping.